And good afternoon, everybody. I'm Scott Swan in the Channel 13 Eyewitness Newsroom. We're going to get right out to the Indiana State House today, where Indiana State Health Commissioner Christina Box and Governor Eric Holcomb are bringing us up to speed. We've learned that 14 more Hoosiers have died from COVID-19, and an additional 373 confirmed cases have been now reported here across the state. Let's go out to the State House and pick up the news conference with the Health Commissioner.
Treated is not in the county where that individual actually resides, and so we go back to make sure that the deaths are actually attributed to the county where that individual resides. It's a very sad reality that this pandemic, that our numbers of cases and number of deaths are going to continue to increase. I don't want to minimize a single one of those losses. They are all someone's spouse, grandparent, parent, child, or friend. And I do not want Hoosiers to see these rising numbers and think that that means that the peak has arrived. We have a very long way to go before we reach the peak, and I cannot say enough about how important it is for you to continue to stay home. If you won't do it for yourself, do it for your loved ones, for your neighbors, for those 49 Hoosiers who have already died of this disease. I also want to urge every hospital across the state to continue to update their information about bed capacity and EM resource daily. Very soon we're actually going to be moving to twice-a-day updates. You might not see the value in this today, but in 2 to 4 weeks, you are going to want that information at your fingertips. Our EMS system needs that information to make real-time decisions about where to take patients when hospital capacity is stretched thin. Having accurate information at their fingertips can help us to save lives. Our strike team continues to travel the state to do testing in our long-term care facilities. We were in 6 counties yesterday and will be visiting 8 more counties today. We're discussing ways to further expand these strike teams so that we can efficiently cover all 10 emergency preparedness districts in the state, meaning that I'd like to have 11 teams so we have 1 circulating team available for any last-minute things that come up. As we continue to work to protect our most vulnerable populations, I also want to highlight some of the innovations that our team is seeing across the state. Several of our long-term care facilities are already working to establish specific COVID-19 units. We heard of one owner, Magnolia, that has established a COVID-19 specific unit and is looking to replicate that elsewhere. What they're doing is amazing. We have an exterior entrance, a dedicated space for healthcare workers to change into their PPE, and everyone is contained to 1 unit. The workers are so dedicated to this that the maintenance man asked to live on site, and the nurse who's supervising this unit is living in a camper nearby just to stay close. These folks have stepped up saying, this is who I am and this is what I do, so that we can take good care of residents and their communities by simply doing the right thing. Indiana is also working to identify locations around the state to help other vulnerable individuals who may test positive. Many people want to isolate at home, but for those who can't, we want to make sure that we're able to offer options to Hoosiers. We have formally requested the assistance of the Army Corps of Engineers to provide facility assessments and other planning help so that we are prepared to set up field hospitals in key areas of the state if this becomes necessary to address medical facility shortages arising from COVID-19. This request was made through the State Emergency Operations Center and FEMA in coordination with HHS. As we said yesterday, our hope is that we never need this, but we must prepare as if we will. The governor also specifically asked me to update everyone about the use of hydroxychloroquine and chloroquine for the treatment of COVID-19. I want to emphasize that the data of the use of these medications to treat COVID-19 is very limited and very small studies, and that there are a lot of studies that are much larger ongoing at this time. Some individuals are actually using these medications on a daily basis to try to prevent or prophylactically prevent them getting COVID-19. Again, there is very limited evidence about the success of this in preventing an individual from getting COVID-19. Most importantly, hoarding these medications or usage that is not indicated severely limits the usage of these medications by individuals who have been using them for years for their autoimmune diseases like rheumatoid arthritis or lupus. The decision about whether to use hydroxychloroquine or chloroquine for treatment of an individual that is hospitalized or sick with COVID-19 should really come down to between the provider and the patient. Finally, I want to say how incredibly grateful I am for the outpouring of medical professionals who have volunteered to help with this crisis. Yesterday, I think I mentioned about 5,300 volunteers. Today, that's 11,000 volunteers, not including medical students and nursing students. These volunteers include doctors, nurses, paramedics, dentists, veterinarians, therapists, midwives, and many others. Every day, I hear of heroism displayed on the front lines in our healthcare and our first responder workforce. Watching Hoosiers help Hoosiers, hearing these encouraging messages that so many people are sharing and watching communities band together in this very difficult time is incredibly inspiring to me and our team, and it gives me the confidence that we will emerge from this crisis stronger as a state. Thank you.
Thank you, Dr. Box. Before we all are available to take any questions that you might have, let me just quickly, per routine and I guess proper etiquette, give a few shout-outs and thank yous to spread around the state of Indiana. So many people are stepping up. You, Dr. Box, you just mentioned how it went from 5,300 at 2:30 to it was 8,000 at 5 p.m. and then over 11,000 right now. Mercy. Thank you. Secondly, I also mentioned last week, just to give you an update, that there was going to be some exciting news come out of Evansville, Indiana. In fact, the whole southwestern portion of our state, multiple counties, the Mayor Winnicky down in Evansville and some of his cohorts, other mayors in that region, other community leaders set up a COVID-19 crisis response fund. This brought together Posey, Vanderburgh, Warwick, Spencer, $6 million to help on the human services front. And all of those counties, when they unveiled that lofty goal, they already had $1.4 million toward the effort. Over the weekend, they received another pledge of $500,000, a matching fund. They've already received another $300,000 toward that. So by my math, that's a little over $2.2 million toward that $6 million goal that's going to go right into the front lines, the very organizations that are helping the most vulnerable. And so I just salute those local leaders for stepping up right now. This just epitomizes to me the joint exercise that we find ourselves in, the local, the state, and the federal charge that we all share. So congratulations to those leaders. Also want to say in one word, wow. All the sewing clubs all over the state of Indiana, just incredible what you all are doing. We have one here locally called Sew and Serve Indy. This is growing by the minute in terms of what they are producing, in terms of membership. Started with about 750 members. They now have over 4,000 members sewing masks that are going to 200 plus hospitals and healthcare facilities in 15 different counties. They have received requests for about 40,000 masks. This is now going far beyond any one region of our state, and this is just what folks who maybe felt like they were on the sidelines watching this all unfold. They are in the game, and they are playing an MVP role. And so to all those who are producing masks or whatever you're doing to help in this cause, this sewing club here, this one local, is doing about 2,500, have already donated about 2,500. And so nothing is out of our grasp when we're well coordinated, well conducted, and working toward that common goal. And lastly, let me just say, while many, in fact, employees are wondering what's next, wondering when they will go back to work. There's one employer I just wanted to highlight from Lebanon, Indiana, who business started 60 years ago in a garage. They were innovating 6 decades ago, and they're still innovating today. The times have caused them to shift. into overdrive. It's called American Ultraviolet. They use ultraviolet light equipment. They've been doing this to disinfect spaces and mitigate the spread of diseases, whether it be SARS or H1N1 or the coronaviruses that we're seeing one today. They make these handheld disinfecting wands. They used to sell about 10 per week. They've got about a 250 unit backlog currently, and they are shipping as many as they can on a daily basis to food and beverage manufacturers or healthcare facilities. So while so many have had to shift their duties and their daily lives, American Ultraviolet has a "We are hiring" sign out front of their business. They need your help. We need your help to get through this as fast as we can. These three that I just mentioned, these three examples, Hoosier examples of hospitality at its finest, are all organized, are all mobilized, and maybe most importantly energized to see our way through that. And so thank you for your help, and we'd all like to help answer any questions that you might have from around the state.
Up first, we have John Russell from the IBJ.
Hi, John. Morning or afternoon.
Good morning. Good afternoon, Governor. Question for Dr. Box. You mentioned you'd put in a request with the feds for possible erection of field hospitals in key areas of the state. I wonder if you can tell me what locations you have in mind, if that includes the convention center in Indy, and also what is the total capacity for these field hospitals?
So what we have put the request in for is for the Army Corps of Engineers to come and to join with the Guard here as we are looking at different sites across the state of Indiana and the potential use of those sites as additional hospital space. But no, there's no specific sites that have been yet identified.
Or capacity?
The capacity, we'll look at each one individually and basically look at that capacity and the need with regards to the region.
Thank you.
You're welcome.
Brandon Smith, IPBS.
Hey, Brandon.
Hey, Governor. I'm hoping for some clarity on yesterday's executive order as it relates to abortion services. Planned Parenthood says it plans to continue providing abortion services because medical experts deem that necessary. Is it your intention under yesterday's executive order that abortions in Indiana should be halted entirely?
Well, Brandon, look, there's the spread and there's the surge regarding this scourge, and we are all watching the numbers, both positive cases of COVID-19 and deaths mount by the day. We're living in and through an all-hands-on-deck moment, if I've ever seen one in my lifetime, and it is unifying our state in ways that are, quite frankly, beyond inspiring. The executive order that you asked about, that I signed here yesterday, had the coming surge, and the coming surge only, irrespective of your viewpoints on any one issue, had that coming surge in mind. That's why, to answer your question directly, that's why I directed all healthcare facilities, hospitals, surgical centers, veterinarians, dental offices, dermatologists, yes, abortion clinics, to postpone or cancel all elective or non-urgent procedures. That's what the executive order says word by word. So unless, of course, by doing so would cause harm to the patient, in which case, and in every case, I would leave up to the doctor to determine and decide. But again, any and all medical expertise and PPE first needs to go toward, during this window, toward defeating COVID-19. And the sooner the better for all of us. So the question that you asked is addressed very specifically in the executive order.
Rebecca White, WSLM Radio.
Good afternoon, Rebecca.
Rebecca, you have to unmute your computer's microphone. Okay, we'll come back to Rebecca. Abdul Hakim Shabazz, Indy Politics.
Afternoon, Abdul.
Governor, can you hear me?
I can hear you loud and clear.
I'm usually loud. I had a conversation at lunch today with one of the downtown merchants who was really concerned, worried about how long the situation is going to last, particularly with her business, her employees, particularly with restaurants and the service industry. What can you say, to those folks, and like I said, whether it's the mom and pop or the big chain place, about how the state is looking out for them, their employees, and just what should they be doing right now?
Yeah, as I mentioned yesterday, there's a beginning and a middle and an end to this all, and we're tracking the numbers, and the data is going to define what steps we take next. We understand and are equally concerned about the pain that is being put upon all of us, both from a humanitarian and from a economical perspective. What we're trying to do is make sure, one, that our healthcare system doesn't collapse under the weight of all the new cases. And to do that, we've had to change our behavior. As painful and blunt as that sounds, we've had to socially distance ourselves from one another. We know that's how this spreads. We know that's how it compounds its negative effects on us all, our businesses and our family members. And so what we're trying to do is push through this, and of course, keeping in mind that there is another phase to this. When I talk about that beginning, which we're still moving up. I mean, if you look at our numbers here locally, you mentioned you were speaking with her at lunch today here in Indianapolis, but look around the state. As you track the numbers, we're going up, and we've got to get to that peak or that surge and then find our way down, and then not react too quickly that would have a whiplash or a double whammy. I spoke with a number of governors yesterday, and we all concurred, all 100%, that it may be the fact that it is harder to determine how to de-escalate than it is escalating, meaning layering on more and more what we need to do to repel or push back or defeat COVID-19. So we will keep in mind, of course, the humanitarian effect that this is having, adverse, and the economical impact it's having on her and 512,000 other small business owners throughout the state of Indiana, and our medium and large employers. And so we'll put together, and we are doing that right now, economic response package as well that takes her and her colleagues into account. We just got to get through this together and get through it as fast as we humanly can.
Thank you, Governor.
Greg from the South Bend Tribune.
Hey, Greg.
Greg, you have to unmute your microphone.
Okay, can you hear me now, Governor?
I can.
Thank you. This question is related to the demographic data that's released related to cases. We've had some cases, several cases here in the county where some of the obviously bare bones information has been released regarding that, but then we've had situations where the school district and even one case, a Boys and Girls Club, the director had released some information related to one of the cases. So, and if we could explain your balancing act as to having to, what determines what demographic and health data you release versus the HIPAA laws and things like that.
Yeah.
So a very good question, and it's a fine line that we walk, because when we know that individuals have been exposed, especially in a setting where there were a lot of individuals that were crowded together, we do need to trace those contacts that were most closely related or in close contact for a certain period of time with someone, to let them know that they also need to kind of quarantine themselves in case they show up with symptoms. So that is part of public health, is that we do that on a bit-by-bit basis. Now, sometimes we don't have the knowledge of everybody that was in a particular setting, and so we have to sometimes come out and actually say, this particular setting, this particular event, there was someone who tested positive, and if you were at that event or at that setting, you may want to contact your local health department, and we can give you some direction. So it is a fine balance that we do to try to make sure that we protect an individual's privacy, but also protect the general public.
Thank you.
We'll return to Rebecca White of WSLM Radio.
Rebecca?
Yes, thank you, Governor. My question was similar to what he just asked, but I guess there are some of the health departments that are saying that is a HIPAA violation if they release the area that the person has been in that because people can trace that area and figure out the person, and therefore making it a HIPAA violation. And then we have other surrounding counties that are releasing that. And I think that there's, you hear the pros and the cons on both sides. And I guess, are you just allowing like each county to kind of handle it themselves, or do you have
The State Department of Health policy? Yep.
Yes. Thank you.
So this is normally handled with local health departments, but the State Department of Health has been actively engaged in many of these situations and cases. I can tell you that I have seen counties that have listed every single place in the county because someone with COVID-19 was there, even if it was to run in and get a gallon of milk or to fill up their car with gas. That becomes a list of pretty much every business, every facility, every spot in the county, and really doesn't help anybody going forward. So realistically, what we try to do is figure out the length of the time the individual is there and the closeness of contact that they had with specific individuals, and to trace it that way.
Thank you.
Cameron, RTV6.
Hey, Cameron.
Hi, Governor. Good afternoon. Two quick questions for you. If an essential employee gets sick, does that employee have to tell their employer? And then does that employer need to tell the other employees that we have someone on staff who may have coronavirus? And then second, as this conversation about masks continues to evolve on the national level, Dr. Fauci was kind of talking about this. Dr. Box, could you address, should we be wearing masks in the general public now?
Dr. Box can certainly address both of those, but I would say that if you're sick, you need to talk to not just your employer, but you need to talk to your healthcare provider. And then you need to self-isolate if you're showing the symptoms of COVID-19 and follow up with your healthcare provider. There's virtual screenings, there's all different ways, but you need to get to the bottom of, are you sick with COVID-19 or not? And then you might want to follow up with the mask recommendation.
I think that's a really good point, Governor. And I would also say, with regards to the masks, we do have individuals that work with our at-risk populations that, because they are the most likely people to bring the infection in from the outside world with them, we ask them to mask on a daily basis. Again, every individual in an entire state or country masking is, number one, not realistic from a personal protective equipment standpoint, but not necessary. So that's my answer for that.
Marcus Green.
I'm muted.
We're still here.
Oh, well, hello, Governor. I just wanted you to follow up on that part. Does the employer, if I tell my boss I have it, does my employer need to tell my coworkers Cameron may have X, Y, and Z?
It's a very good question, and that's where I would, as an employee, feel that it was my obligation to notify my employer so that my employer could work with me to figure out who do I sit very, very close to, who have I been engaged with very closely, and that's what our local health departments and the State Department of Health can also help you to determine who might be at risk and who may want to self-quarantine or make sure that they're very careful about not being around at-risk populations.
Marcus Green, WDRB, Louisville.
Hello, Marcus.
Thank you, Governor. As you know, Kentucky Governor Andy Beshear yesterday issued an order directing Kentuckians not to travel to other states, including Indiana unless for very specific purposes. I'm wondering if you have any reaction or comments on that, particularly if it may have any adverse impact on southern Indiana. And secondly, would you consider augmenting your existing stay-at-home order to provide similar guidance for Hoosiers?
Not at this time for the state of Indiana. I'm in regular contact with Governor Beshear and Ohio Governor Mike DeWine. We've shared thoughts concerning travel, et cetera, but we're not looking at that at this time in Indiana. The concerns, of course, are workforce needs, but also folks who are, potentially traveling from hot spots. I would just ask anyone who is, in a hot spot right now, don't be traveling. Self-isolate yourself and push back the travel to a different time.
Sherry with the Indianapolis Star.
Hi, Sherry.
Am I unmuted?
You are unmuted.
Okay, great. Thank you. I know that you kind of indicated, or Dr. Boxler kind of indicated at the beginning, that the numbers seem like they're rising very quickly, but we're not necessarily in the surge just yet. I'm wondering if, perhaps Dr. Box could walk us through what sort of numbers you're going to be looking at to kind of determine what the quote surge is, or is that something that you're only going to be able to determine kind of after the fact? Because I hear a lot of talk about, are we in the surge yet? Are we in the surge? When will we know? Yeah,
we see the wave coming. That's what we're planning for, Dr. Box.
Sherry, I think that's a really good question. I think it's twofold. Do I think the surge is starting? I really do think the surge is starting, but are we at the peak of that surge? In no way, shape, or form. Knowing when that peak is will be kind of an after effect, right? So we're looking at the data and we see numbers continue to go up and up and up and up, and then we eventually reach a point, and then one day we actually see the numbers go down. We don't celebrate that too much. We kind of say, well, we'll see what happens in the next day. So we start to watch that trend and then start to know whether we potentially have hit the peak. I will say that other states and other countries have seen little peaks that come and go, kind of waves of this. So we'll have to be, on the lookout for that as we go forward also.
Rob Burgess, Wabash Plain Dealer.
Hi, Rob.
Rob, you have to unmute your microphone.
Hey, can you hear me?
We can.
Great. Thanks for doing this, Governor. I appreciate it.
Thank you, Rob.
So with the stimulus bill signed federally, eligible Americans should receive their checks in a matter of weeks. However, the first of the month is tomorrow, which means April rent and mortgages are due for Hoosier residents and local businesses. I know earlier this month you placed a hold on all new evictions and foreclosures, but other places which have gone into lockdown, I'm thinking of Italy, for example, have suspended mortgages altogether, for example. Are you considering ordering a moratorium on rent and mortgages this month or any time in the future, in addition to the actions you've already taken, especially given how long this could end up lasting?
Yeah, not at this time, Rob. Our executive order that we did sign speaks to this issue about rent or mortgages. Payment, you still need to pay your rent or mortgages. Ours spoke specifically to evictions. So to answer your question very directly, not at this time.
Rick Callahan, The Associated Press.
Yep. Hello, Rick.
Oh, can you hear me?
We can.
Okay, this question is probably for Dr. Box. This question might have been asked in recent days, but do state officials have any tracking data yet on how many of Indiana's COVID-19 patients have recovered? And if not, when might that data be available, and what will officials be looking at in terms of the larger trends in the pandemic peak in Indiana?
So a good question, and something I know a lot of people have been asking for. I want to say that I've got the greatest minds in the state working together, from Regan Streif and from IHI and from our School of Public Health and from Indiana State Department of Health, all working to get this data available and accessible to you as soon as possible. Again, when we get better coding, which should be in the next couple of days from the hospitals, we'll start to get that coming in, and we'll be able to have more ideas about individuals that have been diagnosed with, admitted, and now discharged with COVID-19 and the comorbidities associated with that, and more information about the deaths in Indiana. Unfortunately, I just don't have that yet.
Thank you.
Steve with KPC Media.
Hey, Steve, again.
Good afternoon again, Governor. Question probably for Dr. Box, mostly about testing. Looking back, I've heard before that cases today is kind of a shadow of transmission. A week ago, we heard that some of the cases that are being reported may be as old as 2 weeks ago, depending on where they're coming from. So I wanted to get a better handle on, in the best case scenario, we heard yesterday we don't have any rapid response testing in the state yet. So in the best case scenario, a test today is going to be available and show up via the statewide numbers when for people who are following these?
So a test that's done today, if that reaches our lab today, will be reported out in 24 hours, and we'll report on that. The thing is that much of our testing that has been done that's not associated with people that are admitted to the hospital or high-risk individuals has been sent through outside labs like LabCorp or Quest Lab, and they are just very backlogged with all the testing they're doing for the entire nation. Indiana, as you know, has IU up running locally, and Lilly and ISDH lab, and also another lab that's running in northern Indiana, which I'm blanking on the name of, I'm sorry. But realistically, we do have the ability, especially in those hospitalized cases and most significant issues associated with our at-risk populations, to turn that around quickly. Certainly not as much as I'd like to have, but we've got more coming online and more discussions going on right now with another Central Indiana lab to probably increase that by about 10 times.
Kayla Sullivan, Box 59.
Hello, Kayla.
Hi there. So last week, 120,000 Hoosiers filed for unemployment. That's on top of the 54,000 who filed the week before. What's being done to help the Department of Workforce Development handle this major increase?
Fred, you're up.
I think that's a very good question. What we're doing is we've increased our staff, and we've increased the number of people who are answering calls. We've made sure we've had a greater bandwidth on our internet system put in place. And we also have a new system that we're working on in terms of how people can apply for unemployment insurance, and that is the over-the-phone system, and that should take care of some of the backlog.
Michael from WBEZ.
And that was Fred Payne, the Commissioner of the Department of Workforce Development. I should have introduced him properly.
Good afternoon, Governor, from the region.
Good afternoon.
Well, my question is also about testing. Is there a comprehensive list of hospitals in Northwest Indiana that are providing tests? And how long does it take when somebody gets tested up here for the results to come back in?
Yeah, different for different locations.
You're asking the question on the perfect day, because I did just have a discussion with your hospitals, systems up in LaPorte and Porter County and Lake County, and it's Alverno Lab that is running labs up there and getting a turnaround time of about 12 to 24 hours for you. So that has really helped your hospital systems up there to get those results back more quickly so that they don't have to actually send them to Indianapolis to get that done.
Erica Irish, the State House File.
Hello, Erica.
Good afternoon, Governor. Thank you for taking my question. This is probably best directed to Dr. Box. It refers to the number of cases that have been confirmed at this time. Do we have any idea of how many of those cases have progressed to hospitalizations versus how many have resulted in a patient being self-isolated at home?
Mm-hmm.
I do not, because I don't have that data at my fingertips about what individuals were diagnosed and then they were able to stay home. Until I get that hospital data and can cross-check that and determine that this person never showed up in our hospital system, that's difficult to tell. I can tell you that about 15% of our tests are coming back positive, and that the expectation is that 20% of those individuals will become significantly ill to the point of potentially needing admission to the hospital. And then it's that 5% of that 20% that become very critically ill and need ICU and intubation.
Thank you, Dr. Box.
Whitney Downard, CNHI.
Hello, Whitney.
Hello, Governor Holcomb. My question is actually also for Commissioner Payne. I was going to ask how we're treating gig economy and self-employed, those formerly ineligible Hoosiers who are now eligible for unemployment. How are they being treated in the unemployment system, and how is that being calculated for them exactly? I know it's a brand new type of unemployment application for the department.
Right. It is very new, and we still are working with our federal partners on just how we need to administer that. Remember, the first phase was actually getting the stimulus package passed. Now we're working on implementation. One of the things that we're actually looking at is working with our other sister agencies within the state to help identify what previous wages were, because those individuals will have 1099 wages, and we have to treat them a little differently than individuals who had wages reported in a different way. So we're in a process of working on or working through what that method would be.
And do we have any kind of numbers on that? Sort of like, not like a timeline for that?
What I can say with confidence, within a couple of weeks.
Alan Carter, WTHR.
Hello, Alan.
How are you guys? Thank you.
Doing great.
We've seen other states consider the use of antibodies to, one, see if there are people that may be able to get back out into society because maybe they've developed some sort of immunity, but also the possibility of using it for treatment on patients. Is that something Indiana is looking into, and where are we with that?
I'm looking at three doctors right here that are better qualified to, Dr. Sullivan or Dr. Box or both.
So we have a full research team that is continuously looking at all this data and this information and the most recent studies. To date, there's not a reliable way to check antibodies to determine if somebody has immunity to this, which would be like if you had German measles or have you had chickenpox in the past. We can check your blood and determine, are you immune, so you shouldn't get that again. We don't have that accurate test right now. But certainly that is something that people are looking at and studying at this point.
Joy from PBS Michiana.
Hello, Joy.
Hello, Governor. Metropolitan areas in the country are getting hit pretty hard with COVID-19, such as Detroit and New York City. What efforts are the state government making to ensure that other metropolitan areas outside of Indianapolis, like South Bend, Elkhart, Fort Wayne, are taking the necessary steps to minimize the spread of the virus? I believe one thing Dr. Chris Weaver mentioned yesterday was taking pediatric care space to help provide more space for COVID patients. In reference to the Indianapolis metropolitan area, are there additional steps being taken?
Yeah, I'll call on Dr. Sullivan, but every step that we're taking in central Indiana, we're taking in every region of our state, all 10 health regions. You want to talk a little bit about the surge plan that's leading up to this?
Jen Sullivan, FSSA Secretary. Thank you for the question. The description that we used yesterday in our briefing around surge planning includes critical care expanded capacity, step-down capacity not only for individuals with COVID-19 or suspected COVID-19, but also other patients who are still getting sick like you do on a regular basis. Additionally, providing help for individuals to stay at home during their illness. And the process that's happening here in central Indiana is not unique. It's happening across the state. And what we're rolling out is additional supports for regions to serve their networks as one, so that individual hospital systems don't have to go it alone. They can have not only the support of the guidance from the state, but the support of each other and partnerships across multiple different networks that are unusual in providing health care, but are absolutely necessary in providing care now.
Thank you.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Hello, Nikki.
Hello, Governor. I was wondering if we have any estimate on the number of Hoosiers who will die from this. I've seen one that was mentioned in a White House briefing at about 900.
Will you say that question again, Nikki?
Yeah, I was wondering if we have any projections on the number of Hoosiers who will die from COVID.
Projections.
Quite honestly, we have not modeled that number here in the state of Indiana. I would say some concerns that I have is that Indiana does have a higher percentage of more elderly people than some places, and also we do have a higher percentage of smokers, which has been concerning. But to actually try to model the numbers as being this being the low, this being the high, or this being the actual probable numbers, we have not done.
Thank you.
Emma Kate, Chalkbeat.
Hello, good afternoon.
Hi, Governor. What does the late April surge or peak mean for schools and that May 1st date? Should schools be prepared for longer closures, and will they be asked to make up lost days during the summer?
Stay tuned to later this week. We'll have some updates in a matter of, I'll say, 48 hours on just this topic. You'll see Secretary McCormick and I together yet this week to address this very question.
Last question from Richard Essex, Wish TV.
Hello.
This is actually Dan Klein, but thank you, Governor, also with Wish. You mentioned de-escalation. Beyond just the obvious, the numbers are going down, are there other factors that you're looking at when you had mentioned it's going to be more difficult to actually determine how to de-escalate than it is to escalate? So what other factors might you be looking at beyond just the sheer number and volume?
Yeah, Dr. Box, you may want to comment on this, but what we don't want to do is be premature about just reflexively jumping back after we hit that peak and come down and appear to be, because you've seen around the world where it'll slope back up again. So the numbers that I'm looking at is on a gradual, methodical way of we'll always be in this new normal. Things will be different going forward for obvious reasons, but the numbers will drive when we ultimately make these decisions.
The governor's exactly correct on that. I would also say that it'll depend on where our healthcare systems are at that time. We may need to give our hospital systems some time to recuperate, to make sure that they've been able to replenish their PPE, that we are, that our healthcare personnel are able to get a break in the action. So we would not want to release anything too soon and then have another large surge into the hospital system right at a time when they're trying to recover.
Thank you for joining today's briefing. The governor will hold his next briefing tomorrow at 2:30 p.m. Eastern.
And you've been watching today's update from the Indiana State House, the governor and state health commissioner bringing us up to speed with how the COVID-19 surge plan is going today. And what we really learned from today's news conference is that according to the state health commissioner, the surge, she believes, is underway. Now, the peak, she says, we have a very long way to go before the peak takes place. Yesterday, the state officials were estimating that the peak of the COVID-19 pandemic here in Indiana would be somewhere between mid and late April, maybe even as late as mid-May. But they say that the surge is probably underway, but we've got a long way to go before the peak actually happens. We also learned that 14 more Hoosiers have now died from COVID-19, so our sad death toll now is now up to 49 statewide, and we've seen 373 more positive cases of the coronavirus since yesterday. So that was a representative, Christina Box said, that represented a very big increase in the number of confirmed cases statewide. We also learned today that the State Health Department is now working with the Army Corps of Engineers to try to determine some field hospitals across the state should our healthcare system need more beds, hospital beds, critical care beds to take care of any COVID-19 patients. They did not identify any specific venues, but they did say that they have put that request out to the Army Corps of Engineers. So we have a A team of reporters fanned out all across the state today, doing their interviews and their stories, working remotely, and they're going to go ahead and assemble our newscast that will begin tonight at 5 o'clock. But for now, I'm Scott Swan. Let's get you back to our regular programming.